Hello, my name is Annie Zainid. I work with Maricopa County Public Health as a Community Health Impact Analyst, and I'm excited to speak with you today about our CHNA, or Community Health Needs Assessment 2023 Survey Training. Our objectives of this training are for attendees to understand the purpose of CHNA data collection, the target population for data collection, how to collect survey data, how to promote the survey, and to be able to communicate the purpose of CHA data collection and how to complete the survey. Save the date, the needs assessment is about to launch on March 1st, 2023. We're really excited to have your support, whether you're volunteering with us, working with the county, or a community member who's just excited to get out there and understand the priorities of your community in having a life full of well-being. So we want to give a little bit of background first on what is a community health needs assessment. So I'm going to play this video.
What does health look like in your community? Join us as we explore the health and well-being of residents of Maricopa County through our upcoming Community Health Needs Assessment Survey, launching in March 2023. Maricopa County Department of Public Health strives to create a healthy, thriving Maricopa County for all by listening to what's important to the community and engaging people in meaningful ways. To do this, we collaborate with healthcare systems and community partners to conduct a Community Health Needs Assessment, also known as a CHNA, every 3 years. By working with community partners, we have increased the level of resident input we collect over the last 10 years. When more residents reflecting the diversity of Maricopa County take the survey, we can better identify and address the issues that people in our community care the most about. What has CHNA data shown us so far? For the last CHNA, we conducted 2 community surveys, one standard survey in 2019 and a supplemental survey in 2021 about the impacts of the COVID-19 pandemic. Across these 2 surveys, the community identified the following priority areas. These top priority areas also emerged in stories shared by the community. Here's one story shared by a community member regarding their physical and mental health impact.
So where does this data go after it's collected? The CHNA data has sparked action to accomplish the following. Share data with at least 7 major hospitals and healthcare providers to inform new approaches to serve the community. Center community voices to inform decision-making for program and policy development. Direct funding to local community organizations to address top community needs such as mental health, access to care, and social determinants of health. And inform the CHIP developed by over 100 community partners who form the Health Improvement Partnership of Maricopa County. The CHIP is a long-term systemic effort to address health needs based on results from the CHNA. What else can promote well-being and health equity? We look to community members to tell us in the upcoming CHNA launching in March 2023. As a leader in Maricopa County, your partnership is key to that success. Our collective efforts to promote the survey among our networks, both virtually and in person, will help ensure that we capture the most representative community data. We hope that our collaboration will provide strong opportunities for Maricopa County residents to achieve lifelong health. Visit maricopahealthmatters.org to explore past survey results, complete the CHNA interest form, and become a CHNA champion today.
So that provides a little snapshot of what it is that we do here with our Community Health Needs Assessment, why it has an impact on the health and well-being of residents, and why it's important for us to do our best to collect representative data in our communities. For the past several years, we've really increased our ability to collect quality data by offering the survey in virtual and paper format, presenting a regional approach to make sure that we're accessing folks from all areas of the county. We're now providing the survey in 14 languages. And we've also been able to provide grants for outreach to community partners who really know the folks around them the best and can outreach to them to promote the survey. We've seen an increase in survey participants. In 2019, we had nearly 12,000 respondents. In 2021, over 14,000. And this year, as we look to collect data, we're really excited to hit high numbers. But most importantly, we want to get representative data that reflects the diversity of our communities. So in 2021, we saw underrepresentation from Hispanic, Latinx, African American, Black, and male individuals. This graph shows the light blue bars are the 2020 population percent of Maricopa County, and the darker bars are the percentage of 2021 survey responses. So we do see underrepresentation among certain categories that really makes it harder to understand the priorities of all Maricopa County residents, and also to dive deeper into that data to kind of get a clear picture of what people are experiencing. So our goals this time around are really to increase the diversity of our participants to make sure that we're getting the best quality data and the best quality view of the county possible. One of the ways that we really try to understand experiences is by supplementing our data with qualitative analysis or analysis of text responses. So one of the questions in the survey is basically open-ended. It says, what additional feedback would you like to give about your health and the health of your community? In previous years, we had over 4,500 people fill out this question. We're able to see themes about vaccine experiences and opinions, mental health impacts on affordable living essentials, and information news coverage. You'll see here that some of those quotes really contextualize what people experienced. For example, the second quote says, misinformation appeared to be a cause of mental health issues like depression for some in my community. A lack of trust in media and health institutions led to inner conflict, social exclusion, and depression. So you really kind of get that deeper sense of what people are experiencing in the context for that data that we're looking at in the survey. This data has led to us being able to publish a lot of the quotes from individuals while retaining their confidentiality. One Maricopa County resident shared, there are so many stories to be told and many that may never be heard. We hope in our efforts to collect CHNA survey and focus group data, we can continue to elevate and promote those voices of our community. So what have we done with data in the past? We've tried to provide that data in the most useful formats for our community members. We create in-depth data reports. We create regional, city, and zone profiles so people can get a closer look at the responses from their city or the region they live in. We have a dashboard called the Voices of Maricopa County that's completely built around those quotes that we received from participants in the 2021 survey, but also is currently collecting information if people want to respond to the surveys that they have, or respond to the stories that they've read, and to be able to share their voice in that way as well. So who makes this work happen? A lot of it's based on the community and our strong community sectors and relationships. At the county, we serve as the backbone agency of this work by bringing together the Synapse Coalition, which is a group of hospital and healthcare partners. As hospital and healthcare partners, are required to do a needs assessment of the community every 3 years to retain their tax exempt status. So we work together with them to share the data that we collect as a community, and this is used by them to inform the use of community benefit dollars, to inform priorities of the organization, modifications to health delivery, all those kind of things. So really bringing the community's voices into the healthcare sphere. Another strong partnership we have is the Health Improvement Partnership of Maricopa County, which is created and led by community partners. What they do is they look at a lot of the data that's collected as well as population data, and they make health improvement plans that can be utilized across organizations and agencies, really taking that information and putting it into initiatives. All of that serves as a collective movement of Maricopa Health Matters. So what are our goals for this year? We're hoping to collect over 14,000 representative survey responses, to increase city and town participation for engagement and data collection, and to increase our partnerships for engagement and outreach. At the end of the year in 2022, we opened up some community grants for organizations to apply to distribute the survey in their communities when it opens in March. These are the grantees we're working with, so you can see we have quite a range of sectors involved here, from support communities to clinics to school districts, really just a lot of wonderful organizations from across the county. This past year of 2022 has been very busy preparing the survey. From August through December and January, we conducted 2 rounds of pilots for the survey, where we put the survey in front of 80 different community members and got their feedback on the ways that we ask questions, ways to modify the wording to improve the quality of the tool. March 1, the survey officially launches, and the data will be collected through May 31st, 2023. We'll also be conducting focus groups during that time. June through August is when we'll be analyzing the survey data. In November, you can expect to see data reports, profiles, and updated data dashboards on maricopahealthmatters.org. So how are we going about recruiting diverse participants? These bullet points represent some of the focus populations that we are going to be specifically recruiting for the CHNA survey. So we see groups that were underrepresented in the past for whom we want to understand more about their experiences and opinions and priorities. So what does it look like to conduct the survey? Our survey products include electronic surveys that can be taken on laptop, smartphone, tablets, as well as paper surveys. We also have resource pages that are available both on the electronic format as well as the paper format. Available languages include Arabic, Chinese, English, Kinyarwandan, Lao, Spanish, Thai, Burmese, Dari, French, Korean, Navajo, Swahili, and Vietnamese. We'll also have surveys available in large print as well as in Braille. So what does it look like to promote the survey and to collect this data? The first one is to ensure voluntary consent to participate. So that means that participants need to feel that they are choosing to take the survey and not be pressured or coerced. For example, we would not require people to take the survey to receive services or necessities such as food stamps or medical care, and avoiding situations where people feel that they have to give this information in order to receive what they need. We also recommend do not go door to door, not only for the safety of staff, but also to ensure that residents feel that they can opt into the survey as opposed to having to opt out. Another tenet is to ensure respondent privacy and confidentiality. So that means to not watch as participants answer or read through their responses unless they ask for help, and to keep completed surveys in a secure location. Several of the questions on the survey can be sensitive, and so just being mindful of folks' privacy while they're taking it is essential. Another important item is avoid biasing participant response. So you can provide explanation about survey terms when needed to, but don't answer for the participant. If somebody needs help understanding a term or what a question means, you can absolutely give that explanation, but let them be able to answer it with the information that they understand. Only provide appropriate survey gifts. Money as a form of compensation for survey participation is highly discouraged, but there are other items and gifts that can be utilized. And then lastly, always obtain parental guardian verbal consent for minors. And then do not provide the survey in schools or in any situations where it's difficult to obtain parental consent. Pick up and drop off. So many of you are likely volunteering with events or with groups that will be mainly responsible for bringing the surveys out and collecting them at the end. But if you are a partner organization, you would like to receive paper surveys, pick-up and drop-off will be held at the 4041 North Central Ave complex. We have a great team working to schedule those appointments for pickup and drop-off. There's a QR code here which you can scan if you would like to fill out a form requesting materials. And you can always reach our team at Maricopa Health Matters at maricopa.gov. Our team will be doing all data entry from paper surveys. So if you're collecting paper surveys at an event, you can just bring them back to us and we'll be entering that data. We also have the survey promotion toolkit, which will be available March 1st. It includes flyers, social media graphics, email templates, checklists with ideas for promoting the survey. You can find that all at maricopahealthmatters.org. You can also reach out to our communications liaison, Lihem Iyasu at maricopa.gov. We really encourage you to share this information with your communities and networks to make sure that we can get the best participation we can get. So let's stay in touch. Survey pickup and drop off can be scheduled at Maricopa Health Matters at maricopa.gov. Communications, media, and marketing, your go-to person is Lee Hemiyasu at maricopa.gov. And then your community health needs assessment team includes myself, Annie Damude, also my colleagues Tiffany Tu and Pearl Gore. So if you have any questions you have about this training or any additional information that you would like, if you just want to say hey and tell us about your plans for promoting the CHNA, definitely connect with us. We love to be in touch. Lastly, become a CHA champion. If you are wanting to keep up on all things CHA related, scan this interest form, fill out your info, and you'll get regular emails about where we're at in data collection and reporting, those types of things. So just want to thank you so much for your time. We really appreciate your partnership as we do this important work of understanding the needs of our community and working together to create a better, healthier Maricopa County for all. Thank you so much.